anybody who doesn't want to be recorded, please turn your camera off for the next 20 minutes or so. Welcome to everybody who's joined us today to the Community of Practice. Really happy to see you here. Thanks for taking time out of your busy diaries. We are an informal network who meet regularly to build our understanding and promote awareness of racialized health inequalities and the impact of racism on health and on health care, and also kind of share good practice and actions we can take to address this. There's great power in collective action, and I think this is a really, really good forum to help us build momentum and work together. Most of you will probably be aware that the Cabinet Secretary for Health and Social Care, Neil Gray, has recently issued a statement in which he very clearly named racism as a significant public health challenge and has called on NHS and social care organisations to lead on anti-racism. On the back of that, we've also published some guidance to support health boards, and Lauren will very shortly post the links to the guidance and to the Cabinet Secretary statement in the chat, as well as information on how to join the Community of Practice. Today, however, we're really, really happy to shine the spotlight on the great work that NHS Lothian are doing, and we have got Rakia and Laura here to speak to us. We've got a really packed agenda today, so you will have seen on the screen the agenda. You'll see there's a part 2 to it, so we're going to try our best to stick to the time. And at this point, I'd just like to very briefly introduce Rakia and Laura. Rakia is originally from northern Nigeria. She's been living in Edinburgh for over 22 years, and during this time has been working in NHS Lothian. Rakia is actually a trained registered staff nurse and staff midwife, and since 2019 she has also been the Equality, Diversity and Inclusion Lead for NHS Lothian. Rakia holds degrees in public health sciences and clinical education from the University of Edinburgh and 2 postgraduate degrees, and she's won several awards for the work that she's done on eliminating discrimination and advancing equality. And we've got Laura here as well. Laura is originally from Kirkcaldy. Now, I hope I've pronounced it right. I'm not Scottish, as you can tell, in Fife, and has been living in Glasgow for the last 20 years or so. She's been working for NHS Lothian for 2 years as the head of equality and human rights. And prior to that, she's worked for 20 years at the Equality and Human Rights Commission in legal and compliance roles. So a wealth of experience here. And at this point, I'm just going to hand over to the 2 brilliant colleagues to talk about their work.
Thank you very much, Andrea, for that introduction. And we're quite pleased and glad that you were invited to come and share with this group how NHS Lothian understanding, acknowledging, and taking action to eliminate racism.
Can I just check? Sorry to interrupt. Are we meant to be sharing our slides, or is somebody sharing the slides?
No, we're sharing them. I think
Okay.
Rahima's just pulling them up. Brilliant.
No, brilliant. Thank you. Just checking. I didn't need to do anything. Thanks.
Can everybody see the slides?
Yep, the slides are up.
Super.
Laura seems to be on mute though, so I don't know if. Well, that's just on my screen.
Sorry. Can you hear us now?
Yes.
You can hear us?
Yes, I can hear you now.
Okay, thank you very much. So I'm just going to go ahead now and quickly talk about our teams. It's a very small team of NHS Lothian. Laura Hutchison is the head of Equality and Human Rights, and me, Rakia Suleiman, as the EDI lead. We have a fantastic colleague called Melissa Cruz, who's a project manager, and she's not here today. Next slide.
That's just
Okay. So,
Okay, so I'm going to now just cover a bit about the evidence that we've collected on our journey that's helped us to understand the extent and the impact of racism in NHS Lothian. Next slide, please. So, first of all, about our population. Sorry, I'm seeing messages coming up. Not hear us. Can people hear us? Okay.
Yeah, sound seems okay here. Yeah.
Okay, so we have the support of our public health intelligence team who help us analyse the population data that we have. And so we look at that from the biggest sources nationally that are available, and looking at that for Lothian and the different council areas that of people who use NHS Lothian services. So from that data that we know, we're serving a population of around about or almost 1 million people. Roughly 50-50 split between women, 50-50 split between women and men. In terms of ethnicity, the most recent census data shows that 10.5% of the local population are from the term that we use in NHS Lothian is BME, Black Minority Ethnic groups or ethnic backgrounds, and 89.5%, so almost 90% white ethnic groups. So we had that basis in terms of our population, in terms of what we are kind of looking at in terms of the population that we serve, but also how representative our workforce are. Next slide, please. And we, like other NHS bodies, collect equality monitoring information around the people who work for us. We publish that information annually, the information about the equality characteristics of the staff that work for us. I've put a little bit of a snapshot up here. So we do look at that information annually and try to see any patterns or red flags, anything that jumps out at us. So this is a sort of example of some of the tables that are included in our report that we publish every year. Next slide, please. And one of the things, or here's some of the things that stick out or jump out at us in terms of our ethnicity data around the workforce. So we can see that our workforce is getting more representative of our local population. We're still not there yet, as you can see the difference between 7 and 10%, but if we look at it over time, we can see that it is getting we are getting more representative of the population we serve. However, I've highlighted the areas where you can see the sort of concerns that leap out. So and when we look at where people from our ethnic communities, different ethnic communities work, and Black and minority ethnic communities work, we can see we have no senior managers who have disclosed that they're from a BME background. And so there's around about 60 senior managers in that group. So that's of concern for us looking at that. One of the things that also kind of leaps out at us is that why people are choosing not to share information about their ethnicity. So 17.6% of staff prefer not to say what their ethnicity is. We don't know why that is, but that's something that we need to look into, and we need to understand more why people don't feel comfortable sharing that information. One of the things that we did do was look and see how that compares to other protected characteristics. You can see in relation to religion, actually, it's less people prefer not to say it, prefer not to disclose their religion. So that's 11.3% compared to 17.6%. For sexual orientation, it's 18%, so it's around about the same. So there's work there to be done about understanding why people don't feel comfortable or prefer not to disclose that information. Next slide, please. And we know, the other thing that we know from all the published research, which I'm sure everyone on this call is aware of, we know about the racialised health inequalities that particular ethnic minority communities experience, and the barriers that they experience accessing healthcare, as well as the poorer and the worse outcomes that they have in relation to different conditions. So I won't go through that, but that's really important for us to understand that and to be using that information when we're making decisions about our services, the design of our services, and any action that we need to take to improve outcomes and participation in our services. Next slide, please. And finally, the other area that we look at is we've been spending quite a lot of time collecting evidence around people's lived experiences of working. For us, we still need to do more around people who use our services. And we do collect that information, but we haven't done it as much as we need to. But we've done a lot of work over the last sort of 5 years looking at the lived experiences of our BME colleagues. And on this slide is just some examples of what people have told us in terms of the extent of racism that they've experienced and what the impact of that on them. So they're up on the slides. So what we see from that is the effect that it has on people, but also some of the things that people are experiencing as well. But overall, the impact is significant on staff in relation to being able to do their job and to care for people who are using our services, but also impacts on their health and well-being too. Next slide, please. And I'm going to pass on to Vikia.
Oh, this is the one we're using, yeah. Right. So, following what Laura have just shared with us now, when we understand and acknowledging the next thing we do as an organization. So, NHS Lothian acknowledge that the racism does exist and the impact on the people who work for us and those who we serve. Therefore, it becomes a priority for us to embed it in the fabric of everything we do. And how did we do that? So NHS Lothian, working with the quality and diversity team to make sure that we have our 5-year strategic plan, was from April 2023, was actually published. And those, next slide, please. Slide. Next slide. Thank you. So this is our the 5 years action plan that we have for 5 years, and then it's about upholding the human rights, also eliminating all forms of discrimination, including racism, and then to be more clear, the elimination of discrimination is not just about racism; it's inclusive of everything, and reducing the health inequality that is still existing in our community and those people who serve. Next slide, please. So I'm just going to talk briefly on the issue around the racism. We have an anti-racist organization. We declare NHS Lothian, the corporate management made that commitment in terms of being an anti-racist organization, and we have work that will help us eliminate it to remove this racialized inequalities and reducing racial prejudice. And it's not just talking about it, we have streams of work that is put in place to make sure that we achieve this our aim. Next slide, please. So part of it is also making sure that we have a website where equality and human rights page. We build this page in making sure that we have the resources to support our staff. We publish the information that is necessary, the work we are doing, and the ones that we intend to do. This is also to enable staffs to have knowledge and skill that they will have in working towards our objectives in elimination of racism. So, as I have said before, NHS Lothian is quite committed in being anti-racist, and this is we have the plan. And okay. Sorry, we're using too many. What do you call it? Two screen. That's why it's a little bit. So, is it when we're going to watch the video?
No,
not yet.
Next slide, please. So I'm just going to cover some of the action that we've taken since we've been understanding the extent of the problem of racism in NHS Lothian. We've acknowledged that it exists. We've apologised to the staff who've been affected and people who use our service who've been affected. We've done that public commitment, recognising that we need to do a particular programme of work over 5 years to become an anti-racist organisation. So what have we done so far to sort of put that commitment into action? So one of the pieces of work that Rukia has led on was some positive action in relation to career progression for BME nurses and midwives in NHS Lothian. So that was a programme called Leading Better Care, Leading Across Difference. So there was 150 BME staff who participated in that. We also had managers from white ethnic backgrounds who participated as well, and who were involved in various training and mentoring schemes. And some people also took up coaching roles. And what was achieved from that programme of positive action around supporting BME nurses and midwives career progression was that 27 people were successfully promoted from band 5 to band 7, and there was an increased recognition around or amongst the white managers in those occupations, that more was needed to be done in order to address some of the inequalities that we had identified in relation to recruitment and career progression. And so the organisation at the end of that programme, which was seen to be a success, committed to embed this learning and to continue to do work to address the low rates of career progression that we identified within BME nurses and midwives. Next slide, please. The second big area of work that we've undertaken since 2021 is around recognising NHS Lothian's legacies and historical connections with transatlantic slavery. So what that is about, and some people might think, what has the NHS got to do with transatlantic slavery? Well, we became aware that the Royal Infirmary of Edinburgh and the managers of the Royal Infirmary of Edinburgh actually owned a plot of land and the people who were enslaved on that plot of land in Jamaica, and the profits from that for over 100 years were used to support the running of the Royal Infirmary of Edinburgh. So we, through the support of our charity, NHS Lothian Charity, they funded historical research into that. So we looked through the archives material of all the material that NHS Lothian Archives has in terms of trying to understand the extent of what happened in terms of our history. So that was done. We had an independent advisory group that was made up of people from the local community and staff, and that advisory group came up with a series of recommendations that NHS Lothian Board accepted about how we recognise and respond to that historical legacy. So those recommendations were accepted towards the end of last year, and in February this year, the chairman made a public apology and acknowledgement of NHS Lothian's connections with transatlantic slavery, and they agreed that we would set up an implementation group that would help direct the delivery of the recommendations. Next slide, please. And I should say that is a central plank of our anti-racism work going forward, and learning from that to make sure that we learn the lessons of the past. And it's quite striking, actually, when you look at some of the information that was uncovered from the archives, that you're understanding the managers were under a lot of pressure to try and find financial resources to run the hospital. And therefore that may have influenced their judgment somewhat in terms of where they got that money from. The other areas of work that we've done are around engagement with staff and trying to create support networks for staff, but also as part of those networks, involving them in decisions about what actions we need to take, and in delivering those actions to address racism within the organisation. So we have an Advancing Equalities Action Plan that is led by our Human Resources Department. That's an annual plan that's developed in cooperation with the Staff Equality Networks. And we use the data from our workforce reports as well as the lived experiences from our BME staff network to inform those actions. And that has led to the extension of the career progression for BME nurses and midwives programme, but also some other bits of work around recruitment and progression in allied health professionals and the public health department. Next slide, please. I mentioned earlier that we're doing work around engagement with communities, so we've managed to secure some funding from NHS Lothian charity to do some specific work through the Minority Ethnic Health Improvement Service, which is part of NHS Lothian, but to do work with specific BME communities where we understand that there are significant health inequalities, to understand what the barriers are to them accessing our services, and to work with services, to work with communities in order to address those barriers and to improve participation in our services. We're doing some work with MECOP in relation to Scottish Gypsy Traveller communities and with the community health worker there, and also a really exciting bit of work with QUIZA and Maternity Voices project, which is about trying to understand the experiences of BME women in Lothian's access to maternity services, so that we can try and improve outcomes for BME women in relation to maternity. So all of that work is around trying to build trust and to meet the needs of our BME communities and improve outcomes. Next slide, please. Finally, we've got a big bit of work on education, which Rakia leads. So we do particular pieces of education support with particular directorates or services who have come to us saying that they have identified problems or issues around racism and other forms of discrimination and harassment. So we develop tailored participatory workshops for managers, and then that results in action plans. And then we have annual follow-up and support for those directorates and services. Next slide, please. We've also developed an annual education programme, so we run one-day in-person EDI workshops and we have small bite sessions. We've just created a steering group of people from throughout NHS Lothian who are involved in providing education and training, and the purpose of that steering group is, over the next couple of years, is to achieve the intended result, which is about making sure that equality and human rights is embedded in all our learning and development where it's relevant to do so. And the steering group are helping decide the best ways that we can do that and to implement that. We also have produced a lot of self-directed learning resources, which we're publicising constantly throughout the organisation. So it's hosted on our external website so that all staff can access it, because not all staff have access to the intranet. So it's on our external website, on our staff pages, and we're putting together all the resources that are available that we think are really good and directing people to use them in teams or as individuals to take responsibility for their own learning in this area as well. Next slide, please. I think that might be it. Oh no, last thing. Now, how could I forget impact assessments? We've updated our impact assessment process. And so we now have equality and children's rights impact assessments. This is the pages on the website that have all the resources so that people can have a range of guidance. We've also got some new updated guidance around how to make fair financial decisions. So recognising the difficult decisions that we're having to make just now, but how do we ensure that we comply with our equality duties, and also that we use this information so that we don't make things worse for groups in our population who already experience significant inequalities. I think that's that. A quick rattle through.
Oh, thank you very much, Lola. We're just going to use this chance to ask, we bombarded you with so much information, 5 minutes here. Do we have any questions or comments before we go